Hi, my name is Rebecca Moazes. I joined King's in 1995 to do a Master's in Conservative Dentistry, which was a 2-year course, and I completed that in 1997, and that was just the beginning. Before coming to King's to do postgraduate study, I qualified as a dentist and worked in general practice and community dental service for about 4 years. What really got me interested in conservative dentistry is the experience of actually building a patient's smile and building their teeth and seeing the satisfaction and the happy look on their face when you pass the mirror. I think it's a combination of making sure that you're building on teeth but also preserving what you've got, because up till now we don't have any other materials that are as good as the actual natural dental tooth tissue. I have very good memories of the course. There was 6 of us on the course, and the course was directed by the head of the department and the head of the actual course. And he was actually one of the people that really inspired me along the way. We used to have these very special Friday afternoon tutorials where the 7 of us, the 6 students and the head of the course, used to sit down and discuss the various topics in conservative dentistry. What was really nice was that you felt really free to put forward your ideas, and it was an open environment. We had exchange of ideas, and rather than a person teaching us, we were teaching each other, but obviously having it all directed and learning a lot from the head of the course, who had immense knowledge. But it was that openness and exchange of ideas that was brilliant. The clinical part of the course was just so interesting that I really wanted to continue with that, but I also found the research part of the course really interesting to follow. And therefore what happened was I did actually continue both. One of the highlights of my career was doing the fellowship exam in dental surgery at the Royal College of Surgeons. At the time it was a really tough exam with very, very low pass rate. And I truly believe that my training here and the course that I did equipped me in actually not only passing the exam but being able to obtain the prize and the gold medal for that exam. The person that really inspired me when I entered into postgraduate education was the head of the Conservative Dentistry Master's course. And I really found it amazing that years later I ended up actually heading that course myself. I think what I love about my work is actually the variety. What I really enjoy is being able to carry out my clinical practice, but also teach and hopefully be able to inspire others. I love mentoring the students, and also to be able to carry out research, to do all 3 things together is absolutely great. There's no doubt that you have world-class experts here and fantastic physical facilities. And I think all of that is really important. I think one of the other really nice things about King's is that we are King's Health Partners, part of an academic health sciences centre. What that means is that any research is very quickly put into practice, both in terms of teaching and clinical practice. So really you are learning everything up to date and really of the highest standard. But on top of that, I think what I love about it is the multicultural nature of both staff and students, the relaxed atmosphere, the open-mindedness and the freedom of thought and being able to discuss things, and how approachable people are, that you can literally go and discuss anything that you want. I think one of the things that was important for me was when I entered postgraduate education, I'd already been out in practice for about 4 years, and I think that experience really helped me not only decide what it was I wanted to do, but also actually really gain a lot more out of the course. And the other thing I would say is there's never the perfect time to enter postgraduate studies. Obviously you plan your life, but if you want to do it, go for it.